Welcome to ATCM, the Emergency Medicine channel. Today we will be discussing about the hazards and complications of mechanical ventilation. So, what are the hazards and complications? It can either be because of the ventilator or because of the positive pressure given by the ventilator or because of some patient condition, patient related issues, or it can be because of us, either by cross infection like nosocomial infection or by keeping wrong ventilator settings. So, first we will discuss about the ventilator. What can ventilator do and what complications the ventilator can lead to. So either it can be because of some equipment failure or something. The ventilator alarm might be malfunctioning, or the ventilator connection, we will be having some connections and tubings from the ventilator, so the circuit might get disconnected, or accidental extubation of the ET tube from the patient, or intubation to the main bronchus. Or it can be because of post-intubation stridor. There can be some vocal cord edema and post-intubation stridor can be there. Or because of the ET tube, there can be ET tube block, or ET tube might be hitting onto the tissues or to the carina, and that can cause tissue damage. And because of the intubation into the main bronchus difficulty, or it can be because of the difference in distribution of the positive pressure. There can be athletasis of the areas which is not getting adequate pressures and all. So these are the equipment related problems. And the other problem is the complications because of the positive pressure ventilation. So because of positive pressure ventilation, it can cause barotrauma. So barotrauma means there will be an air leak. The air can leak into the mediastinum, or it can leak into the subcutaneous air, or it can leak and it can produce a pneumothorax, or it can produce a or otherwise it can produce a bronchopleural fistula. And because of this excess pressure, what is happening is the venous return will reduce. So since the venous return reduce, that can affect the cardiac output also. So because of reduced cardiac output, patient might have hypotension. There can be reduced perfusion to the organs and reduced perfusion to the kidney. That in itself can cause multi-organ dysfunction to the patient. And because of providing excess FiO2, that can produce oxygen toxicity. Another complication is because of positive pressure ventilation, we might be putting Ryle's tube to the patient, or because of a leak of the pressure, there can be injury to the esophagus, and there can be upper GI bleeding also. So these are the complications because of the positive pressure ventilation. Now, patient related issues. Patient might be already having some infection within, and patient's immunity might be less, and so that can affect the patient condition. Then one more thing is multi-organ failure. So already we are giving a positive pressure ventilation that is affecting the cardiac output. So already the organ perfusion will be affected, and because of the infections and other complications already pre-existing to the patient, these reduced cardiac output and these things can again worsen the patient's condition. Next is related to the medical professionals. So medical professionals, what is happening is there can be nosocomial infection due to some cross contamination during the procedure of laryngoscopy or introducing the ET tube. ET tube might not be introduced sterile and all, so that can produce some nosocomial infections. And if at all we are setting a very wrong ventilator settings, that can affect the patient again. That can because of keeping a very high pressure, that can produce barotrauma, or because of improper setting, that can increase the PCO2 of the patient, or it can produce oxygen toxicity to the patient by keeping a very high FiO2. And some misadvantages. That means if the person who is setting the ventilator is not there when the alarm is blinking or something like that, that can affect the patient's condition. So these are the hazards and complications of mechanical ventilation. So either it can be because of the equipment, or because of the positive pressure ventilation, or because of the patient's underlying condition, or because of the concerned person who is taking after the ventilator and who is intubating, that can lead to some cross infections or some other misadvantages. Thank you.